And joining us live right now is Dr. Alex Garza, head of the task force. So, Dr. Garza, I want to start with this one. The big issue right now is hospital space and staffing. We keep hearing these cases are from outside the area where the restrictions aren't as stringent. If that's true, then how do we handle that? Because we're going to keep getting flooded, it sounds like.
Yeah, well, there's no easy answers for that. So if we look at the admissions that we're getting from within the more urban areas, the city and the county, versus the more rural sort of exurbs and those collar counties, and then even farther out than that. And so we know the admissions from sort of those collar counties are higher per capita than in the more urban areas. But of course, all of those numbers are rising, and so at some point it really doesn't matter where they're coming from because they're there. But we are seeing even more coming from those more rural areas as well. And so I think we saw around 91 admissions last week from those more rural areas. So we're getting transfers in from the rural areas, plus we're seeing those admissions coming up from all areas. The way to take care of that, of course, is to have more consistent policy with mask mandates. And I hate to say it, but I think we're going to have to start moving towards that more safer in place policy as well, because the numbers just are not sustainable.
All right, and Dr. Garza, you had also told us in the past that we're seeing primarily patients in the hospitals who have other issues or maybe pre-existing medical conditions. With this new spike, are you seeing more of the same? Are you seeing things differently this time around?
Yeah, so the pandemic is really sort of changed and morphed over time. So early on in the pandemic, when we had that large spike in deaths and in patients, a lot of them were coming from long-term care and nursing homes, around 50%. We know that that number has come down. It's now around 10%. So now we're seeing still elderly or people that are up there in age, and still people with chronic medical conditions. So that hasn't changed. But we aren't seeing as many coming from that most vulnerable population. However, I am concerned, in talking with our health systems today, we are seeing an uptick in patients coming in from those facilities, which again, I'm sorry to say, sort of makes sense. With so much virus circulating around the community now, really nobody is safe. So we'll have to see how this plays out in terms of mortality. But it's a pretty scary proposition.
Yeah, let's talk about the restrictions here. The Wall Street Journal had a big headline today, and they more or less said the unknown is where people are being infected. Now, to a lot of business owners, this latest round of restrictions seems arbitrary, especially the restaurants, because we don't know where the cases are coming from, if it's schools or churches. So do you agree with how we're going about it this time, or is it time just to lock everything down again?
Yeah, that's a really good question. We don't see the case data, so the health department handles all of the case data. So when I say that, it's, where are people getting infected and all of the contact tracing. Now, certainly there's no sort of one single place that you can point to and say, if we only fix this, everything would be taken care of. And so then you get contributions from places like restaurants, bars, some from school too, although not as much. Other places, gyms, churches, all of the other places, and people that are getting together in their own homes. So really, I think the message is anytime people come together in an enclosed environment and don't practice, masking, social distancing, you're always increasing the odds of transmission. And now, with, as I mentioned before, so much virus out in the community, the odds of transmission occurring even in those places that have done a good job historically, like the restaurants, are now at even higher risk because there's so much virus in the community.
I also want to touch base on the vaccines. We now appear to have two viable vaccines, one from Moderna, one from Pfizer. They may be more on the way. Your thoughts on how that's going to play out and how it will impact how we move forward?
Yeah, so what I tell people is it's great news with the vaccine. Very good efficacy. The Pfizer is 90 and Moderna was 95%. So that is great news. They're also similar vaccines. They're both mRNA vaccines. So, but what I tell people, or what I warn people about, is this is great news, but it's not going to show up at our doorstep tomorrow. It is a light at the end of the tunnel, but it's a very long tunnel. And we're still going to have to wither through these months where we're seeing increased cases and hospitalizations before a vaccine becomes available in any appreciable number. For the general public, that's probably not until spring of 2021. And that's just because manufacturing hasn't caught up, all of the distribution channels, and it's going to be really a Herculean effort to get the population vaccinated once it does become available.
Hey, Dr. Garza, one more for you before you go. On Friday, you had your typical briefing, and you got very emotional talking about your staff. Why?
Yeah. You know, you talk to your staff, and you hear the stories, and you see all of the things that they're struggling with. And I don't know, it's hard to sit there and listen to those stories and not feel compassion for them. And knowing that, we're asking them to do this tremendous thing of taking care of all of these COVID patients. And it's a strain on them, not just physically, but emotionally and mentally. And I think that's why I get so upset, because I think about how is that impacting them in their lives. They really are becoming victims as well of this pandemic.
Well, we absolutely understand the emotion, and we thank all of them for their hard work. Dr. Alex Garza with the St. Louis Metro Pandemic Task Force, thanks so much for your time today. We really do appreciate it.
Sure.